A CT angiogram is used when doctors need to check for blockages in the heart arteries, and it's becoming a common option for people with a variety of heart conditions. Dr. Matthew Buddof, Principal Investigator of Cardiology and Director of Cardiac CT at LA Biomed Research Institute, gives us some insights into the research he is doing.
Heart disease is the #1 cause of death in every industrialized country around the world and really is underdiagnosed. We often find out about patients once they die or have a heart attack that they have something wrong with their heart. My research here at LA Biomed revolves around early detection of heart disease, finding the disease 10 to 20 years before the heart attack or death occurs, where diet, exercise, and certain medications can reverse the process. With our original test, the calcium score, that's more of the cement, the permanent stuff. Those are the bones that are building up in the coronary arteries, making it hardening of the arteries. That's really where the term atherosclerosis came from, was hardening of the arteries. That's due to the calcification. But what we can see now with the CT angiogram is the soft plaque, the early plaque. And we've now shown in a recent study that you can actually reverse the soft plaque, that you can suck out the fats out of the artery and make the artery better. We use a CT scan, a CT scanner, a very specialized CT scanner that's fast to take fast pictures of the heart, to freeze it, and then we can see the images accurately. And we look for calcifications first, and then we look for actual plaque and blockages as a follow-up. So we can now see not only is there calcified plaque, our original test, the calcium score, but now we can actually see, doing a non-invasive angiogram, whether there's a blockage in the certain artery, how severe it is, how much plaque is there, and then we can plan on what the next step would be.
Karen Fouts, a patient of Dr. Buddof, tells us why she had a CT scan of her heart.
I had an EKG, and it was a little bit abnormal. And so my cardiologist said, well, let's check this out. So he did a few other tests, and he said, well, those are all clear and fine, but I just want to see why it's the way it is, why your heart is doing what it's doing.
Karen talks about her procedure and the results.
First, they took my blood pressure and made sure everything was okay there. Took me in the room, had me lie down on a table, made me comfortable. They put an IV in my arm, and they told me exactly what was going to happen, that I was going to feel this and do this, and I was going to hold my breath for just a short period of time, and then it was all done. And then right after, the doctor brought me in and showed me the pictures and said, you're clear, you're clean, looks great.
No plaque, normal heart, no soft plaque, no hard plaque, you're good to go. So you're very healthy.
Dr. Buddof, where are you today in this research?
We're in a very good place right now. Calcium scoring, the calcium score, that's very low radiation, that affords us a quick look into the heart for plaques. How much plaque do you have? Gives us the best way known to identify patients who might have heart disease. So it's the best predictor of future heart attacks known, and it's now recognized by the American Heart Association, the American College of Cardiology, the European societies. It's paid for by about half the payors now, not all of them, but it is a well-recognized test for the detection of silent heart disease. The next test that we developed was a non-invasive angiogram, where we can actually see the percent blockage with over 90% accuracy, and we can detect the amount of plaque. So what I'm trying to do now is to validate the plaque test to get a volume of plaque. So you can know how many milliliters of plaque you have in your coronary arteries, and then we can track that over time. So I can look at, is your statin dose correct? Is your blood pressure pill the best one for you? By saying, you know what, over the past 2 years, your plaque has gotten worse, your regimen is not correct. So actually be able to validate that we're doing the right things for the patients, that they're under the proper care. And we're doing a lot of validation work right now looking at this non-invasive angiogram with the CT scanner to prove that it's the best way to track plaque over time. People who see these calcified plaques in their arteries actually become better patients. Because a big problem right now is a disconnect. Everybody believes that if you have high cholesterol, you're going to have a heart attack, and if you have low cholesterol, you can't have a heart attack. But cholesterol only explains about half of heart attacks. So half of the people are going to have a heart attack with low cholesterol, and half are going to have a heart attack and never have a heart attack with high cholesterol. It only explains half the game. So what we've been able to show is that if we can show patients that they do have plaque, that they behave differently. They're better patients, they diet more, they exercise more, they take their cholesterol pills, they change their lifestyles to become better patients. And it's a good motivator for long-term good behavior. Because obviously it's a long-term game, not a short-term game when we talk about heart attack prevention.